Good afternoon, everyone, and welcome. Thank you so much for joining us for this special press event this morning or afternoon, pardon. I'm so glad to be joined by Representatives Don Beyer and Representatives Jack Bergman. We'll be getting started in just a few moments. But before we get started, please allow me a moment to introduce myself. My name is Emily Taylor. I'm the Director of Advocacy and Community Relations for the Solve M.E CFS initiative. And I also have the proud honor of being the primary staff for the Long COVID Alliance, a new coalition with over 95 different organizations, companies, and nonprofits that have come together to find answers and transform our understanding of post-viral illness and help get millions of Americans with long COVID and around the world back to health. So just before we get started here, I just want to make sure that we have a quick tech update. So I'm going to just give us about 2 minutes and I'll go ahead and walk through the agenda. But first of all, I'd like to let everyone know this is a Zoom press event, and we will have a moment to take questions at the pause between our two panels today. Our first panel is, as I mentioned, Representatives Don Beyer and Representative Jack Bergman from the great states of Virginia and Michigan, respectively, who will be sharing some really exciting updates about the COVID-19 Longhaulers Act. If you'd like to ask questions during this moment, we will be taking questions from media only. And a special welcome to our members from the chronic illness community who are also joining us today. For the members of the media who are joining us today, if you would like to ask questions during our Q&A, you can either raise your hand using the raise hand function at the bottom of your screen, or there's also a Q&A tab where you can submit your question and we will call on you. If for some reason we're unable to get to your question, or you would like to also request an interview at a later date, please feel free to email our team, Carmen Creglow at Creglow, K-R-E-G-L-O-E, at Solve CFS, like solve a puzzle, CFS for chronic fatigue syndrome, at solvecfs.org. And I believe with that, are we ready to get started?
Yes, for me, Emily. This is Don.
Hello, Congressman. Thank you so much. I know we had a little bit of a tech challenge, but I'm so glad you're able to join us today. So a quick walkthrough of our agenda. As I mentioned, first we'll be presenting Representative Don Beyer, the original sponsor of the 2020 COVID-19 Longhaulers Act, and co-introducing with Representative Bergman in the near future for the new version. We'll also have a quick moment after the members of Congress have spoken for questions, and then I know you all have committee votes, so we'll cut you loose at that time. And then following, we have remarks from our President and CEO Oved Amitay here at Solve M.E CFS initiative, and wrapping us up is Cynthia Adinig, a constituent from Representative Beyer's district, a person with long COVID, and an amazing advocate who has been featured recently in Time Magazine and other Washington Post and other publications as well. So without further ado, it's my absolute pleasure to turn over the floor to Representative Don Beyer. Thank you again, sir, for joining us. We are so grateful for your support and leadership.
Emily, thank you very much. And I'm really proud to be here to announce this forthcoming COVID-19 Longhaulers Act. And I'm delighted to do it with Lieutenant General and Congressman Jack Bergman. Jack and I also co-chair the Swedish caucus. And in a country that's so divided, it's so nice to be able to do something in a bipartisan fashion, for the good of all Americans. We talk often about the immediate dangers of hospitalization and death from COVID-19, but what's rarely talked about are the symptoms that don't immediately go away after acute infection. These folks self-identify as long haulers, or those with what we now call long COVID. How long it takes to recover from coronavirus is different for everybody. So many people feel fine after a few days or a few weeks, and most are going to make a full recovery within 12 weeks. But for some people, symptoms can last longer. The chances of having long-term symptoms does not seem to be linked to how badly you feel when you first get it. Some people have very mild symptoms at first, can still have long-term problems. For many people, long COVID can be much worse than their initial bouts of the infection, with a stubborn and complex array of symptoms. A study that analyzed electronic medical records in California found that nearly a third of the people struggling with long COVID symptoms, shortness of breath, cough, abdominal pain, didn't have any sign of the illness in the first 10 days after they tested positive for coronavirus. And surveys by patient-led groups have also found that Many COVID survivors with long-term symptoms were never hospitalized for the disease. This may be the single best rebuttal of the idea that somebody should just let themselves get sick, recover, and be immune. Herd immunity has enormous costs for the individual and for society. So most improve over time, but there's a wide variation. Some people after 2 months are 95% recovered, while some people after 9 months are only 10% recovered. In an Italian study, 87% of hospitalized patients still had symptoms after 2 months. A team from the Centers for Disease Control and Prevention found that a third of 270 non-hospitalized patients hadn't returned to their usual state of health after 2 weeks. For comparison, roughly 90% of people who get the flu recover within that time frame. So the overarching takeaway is that millions of Americans have had COVID and many suffer from lingering effects. What those are, who is susceptible, why it happens, are still being figured out. I'm proud that in our latest COVID package, which I think Jack and I both voted for, we allocated over $1 billion in research to NIH to study long COVID. But what's still missing is the practical application of how we respond to long COVID and what we can do for those who currently suffer from it. And that's where our bill comes into play. Right now, much of the information we know either comes from patient forums who coalesce to respond while the rest of us were focused on acute infections and death rates and vaccine preparations. And well, the rest of us are sort of siloed with the work of the medical practitioners. So the cardiologists might track COVID-19 impacts on the heart and neurologists on the brain, but the complete picture was missing. So this is that rare moment where we're evolving in real time to respond to the pandemic. And the response needs to reflect the whole picture, including the silent wave of long haulers. So to get to the bill, the COVID-19 Longhaulers Act aims to address the patient experience. First, by synthesizing our siloed data and understanding what's happening and what treatments work, what are the symptoms, what treatments are recommended. And we now hear from so many that getting the vaccine seems to resolve the long COVID symptoms. So who does it fix and why does that work? The bill also aims to improve care by researching long COVID treatment efficacy, delivery, and disparities. Far too often, those more persistent and well-resourced will get access to the best care, leaving behind many effective without the knowledge that could help them. So this tries to address delivery and disparities. And lastly, most importantly, educating our public and our clinicians, and most especially our journalists, about long COVID, so they know how to recognize and diagnose the illness and how to write about it, so that we all know what we all know. So I really want to thank Representative Bergman for joining me in this fight, and to the team of advocates here. And I look forward to listening to what my friend Congressman Bergman has to say. We have work to do, and Emily, I turn it back to you.
Thank you so much, Congressman. And with equal joy and relish, it's my pleasure to introduce Representative Jack Bergman from the great state of Michigan. I'll just also want to note that Representative Bergman has been a long supporter of ME CFS for many years, and I'm especially pleased that he has seen and lent his leadership and his voice to these new issues with public health today. Representative Bergman, the floor is yours.
Well, thank you, Emily, and thank you everybody for being on the Zoom call today. And I'd like to special thanks to my colleague and friend, Congressman Don Beyer, because we do a lot of work together. It just doesn't necessarily show on the surface every day, but we keep our, as basic folks who, as Don said, we also co-chair the Swedish caucus here in the House, and Swedes are known for a hard work ethic. So that's what we do all day, every day. But I'm honored to help Congressman Beyer introduce this extremely important piece of legislation. He did a great job of summarizing it. I'm not going to repeat what he said. Over the past year, we have seen increasing reports of individuals who have mostly recovered from COVID-19, but are continuing to experience symptoms months after the initial infection. The problem with long COVID presents is an extreme threat to our ability to fully recover from this pandemic. And I'm glad to see both parties come together to address this issue once again. In combination with the NIH research funding, we have already signed into law the COVID-19 Longhaulers Act will give us the tools that we need to understand, identify, and treat the long-term symptoms of COVID-19. I'm proud to help introduce this bill, and I'm thankful for the work of all the advocates at the Long COVID Alliance and Solve M.E, all that they have done in bringing this issue to the forefront here in the 117th Congress. So with that, I'll conclude my remarks. Glad you all are with us today, and let's keep the visibility increasing on this issue. Thank you.
Thank you so much, Congressman. So we have a moment now to take a few questions from journalists while we have just a few more minutes with the members here today. If there's any members of the media who would like to either raise their hand or enter a question in the chat, we can call upon you and unmute you for you can ask your question.
Hey there, can you hear me okay? This is Michael Locklear with KUTV2 News in Salt Lake City. I was wondering if you could talk about the funding aspect of this bill, what's the cost associated with it, and how will you make sure that those dollars are well spent?
Well, real quickly, it's $30 million is authorized in the bill. As you know, Michael, Congressman Bergman and I authorize it, and then the appropriators appropriate it. So it's a two-step process. But we then give the appropriators the authority to allocate $30 million, and we'll go right to the CDC, Centers for Disease Control, to manage it through the various agencies. There's PCORI, which is the Patient-Centered Outcome Research Initiative, a really fun thing that's bipartisan across the country that draws directly from patient experience. And then ARC, which I can't remember all the things, but ARC is the big research thing in Washington, D.C. So the hope is that the $30 million will be well spent on specifically the task that was laid out in this bill that Congressman Bergman and I have drawn up.
Thank you so much, Congressman. Were there any other questions from members of the media? We have time for just one more because I know both members have committee votes and many other priorities, in running the government that need to be paid attention to, as important as this issue is. Were there any other members of the media that had a question they would like to ask? Oh, here we go. We have a question from Miss Miriam Tucker. Who is a journalist who often writes for Medscape. Hello, Miriam. It's great to hear from you again. Can we go ahead and unmute Miriam so she can ask her question? Miriam, can you hear us? Or are you unmuted? Oh, well, I can go ahead and ask her question because she did put it include. Got it. Miriam says she preferred to stay muted. Understood. But I'll go ahead and ask your question, which you texted over to us. Miriam asks, does the bill specifically address ME CFS as well as long COVID? And sirs, if I may, I'd be happy to help with that question. Or Congressman, if you'd like to go ahead.
No, go ahead, Emily, because you'll do it more articulately than I won't speak for Don, but I'll speak for me.
Absolutely, it'd be my pleasure.
You can speak for me too, Jack.
Yeah, you both are so kind. I really appreciate the honor. So the piece of legislation, and again, it is emphasizing in a draft form, as currently written, includes education components and data collection components for post-infectious and post-viral illnesses. And among those illnesses, which are kind of interwoven with many of the people with long COVID experiences, we do specify post-viral illnesses, which includes ME CFS, myalgic encephalomyelitis, chronic fatigue syndrome, fibromyalgia, another can be viral triggered syndrome, mast cell activation syndrome, which again, abbreviated MCAS, can be triggered by a viral infection, and last but not least, autoimmune disorders that can also be triggered by viral complexities. So since all of these different illnesses are in the same, we call syndrome soup, and the data harmonization elements that the congressmen have written synergizes all of that data. So we're leaving no stone unturned to get long haulers back to health. Thank you so much. So I believe that ends our midpoint Q&A. I'll just like to remind all of the journalists on the call, we will have additional Q&A at the end of the call, but just because of our time limitations, we do need to say goodbye to the Congressman. Again, thank you so much, Representative Beyer and Representative Bergman. It is truly a pleasure to work with you both, and your teams have been amazing. I just wanted to say a special thanks to Kate and Aaron and all of the folks in all these offices who have been so supportive. Barbara and Ben. I could go on and on, but your teams have been truly fabulous to work with, and please pass our gratitude and thanks along to your staff as well.
Thanks, Emily. Thanks all.
Thanks, Emily. Thank you, Jack. We'll see. Good luck.
Thanks, Don.
Thank you, sirs. And so for just we'll move right along. Thank you all for your questions. We will keep these for the Q&A at the end. It's my pleasure to introduce our CEO and president at Solve M.E, Mr. Oved Amitay.
Thank you very much, Emily. This is the 5th anniversary of Solve M.E's Advocacy Week. And I couldn't be more honored and proud to have the support of Representative Beyer and Representative Bergman to not only help us raise awareness, but also help us attain the much needed funding and policy solutions through the COVID-19 Longhaulers Act. And it's heartwarming to see the bipartisanship that we just witnessed. It is really, we'd love to see more of that. Now, the idea that people may have long-term consequences after an infection, what we now call long COVID, even when the virus can no longer be detected in their bodies, may seem to be new. But in fact, a very similar disease, myalgic encephalomyelitis, also known as chronic fatigue syndrome, is a disease with a very similar story that has been recognized for many years, and today unfortunately impacts millions of Americans. This is a chronic, complex neuroimmune disease that profoundly limits the health and productivity of people with the disease. And much like long COVID, it is often triggered by an infection. And we've seen this in previous viral outbreaks. Unfortunately, there is no cure, there are no FDA-approved drugs, and there are really no effective treatments. But more than anything, I'd like to highlight today is that there's a lack of awareness and understanding of the disease by healthcare providers and the general public. And that leads to disbelief, dismissal, and much unnecessary suffering. Already there are 2.5 million Americans are afflicted with ME/CFS, and COVID-19 is expected to potentially double that number. Yet most post-viral illnesses are in the bottom 5% of funding at the NIH, the National Institute of Health. Solve M.E and the Long COVID Alliance and a record nearly 1,000 advocates and patients are taking action to change that. We've had many meetings yesterday with members of Congress, and we're very fortunate to have this support. Now, today you'll hear more from one of those patients in a moment, and it's a very powerful story. But let me first frame the magnitude of the challenge that we'll be facing. As I mentioned, 2.5 million Americans are currently suffering from ME/CFS. Because of long COVID, it is very possible that another 2.5 million Americans will be added to that list in the coming months. This is a debilitating condition that often impacts people's ability to hold down a full-time job. And as the number of people increase, so that the financial impact. It is now estimated that over the next decade, this will have an impact of about $4 trillion on the U.S. economy. Just take this in for a moment, $4 trillion. So the COVID-19 Longhaulers Act, which will provide funding for research, education, and infrastructure is absolutely critical for long COVID and for post-viral diseases in addition to that. We applaud the congressmen for their $93 million COVID-19 Longhauler Act. We implore Congress to quickly pass and fully fund it. But now to discuss a key part of the COVID-19 Longhaulers Act, which is fighting disparities in long COVID care, it's really my pleasure to introduce Cynthia Adinig to share her experiences. Cynthia is one of the members of the core steering committee of the Long COVID Alliance. It's been a pleasure to work with her in that capacity. Additionally, and perhaps very importantly, she's a constituent of Representative Beyer, and her advocacy is in large part the reason why we're here today. Cynthia brought the patient voice to the center of the COVID-19 Longhaulers Act. So I'd like to thank you again, Cynthia, for being such a critical part of this work, and the floor is yours.
Thanks for that introduction. I'm Cynthia Adinig, and I am a long hauler. I'm really thankful for this legislation to be coming forward, because even as I suffered my long haul, I was reaching out to different of my congressmen, local and state, trying to get this information out and saying there's loopholes and disparities in care, and it comes to the financial side and just the human side of the long haul experience. And so I'm thankful, so thankful that they listen. A lot of us have been trying for a hard time to get Congress to listen, and they listened, and they heard us, and they took us seriously, and they took our considerations and our needs seriously. And I am forever grateful that they have given us this opportunity to be seen and heard. So we've always said early on, back into the COVID experience or the outbreak, that the marginalized communities were going to be more impacted. And that has been happening with long COVID as well. And so I was one of the early people that got sick. I got sick in March of 2020. And it was just sniffles, very light. It was sniffles, but I knew because we were all sick that something was wrong, because we're a very healthy family. And it's very rare that we all get sick. And so when we asked to be tested, we were denied testing, because the criteria in March 2020 said we had to have a high fever or cough to be tested. And that was not the case for any of our symptoms. We didn't know then that COVID spanned a wide range of symptoms, or what mild COVID even looked like. So I was denied testing, and life went on. And a few weeks later, it was actually a Mother's Day in May, where I started to feel really bad. I ate something, and suddenly I was lightheaded, dizzy. I thought I was going to pass out, sick to my stomach, nauseated, jaw was tight. Did not know what was happening to me. Had my husband call the ambulance, rushed to the hospital, and they said that it was anxiety. And I said, there's no way it's anxiety. I'm just a graphic designer enjoying my time in quarantine, playing video games with my 4-year-old son. I was living the dream. I was having a great time in quarantine as an introvert. I was living it up. So I knew it was not anxiety. And then again, it happened a week later. And then they said the same thing. Oh, it's anxiety. You're watching the news too much. You must be stressed out by the news. I've been playing video games for like 12 hours a day. I'm not even watching the news. I'm enjoying my time with my child and my family. We were having so much fun family time. And then again, it happened 2 days after my birthday. And that was the scariest moment of my life. I thought, as my husband held my hand on our way to the hospital, I thought I was going to die. I thought I was going to die twice. My heart was racing. I didn't know then that my heart rate was at 160. It was the first time that I experienced intermittent paralysis, that a lot of people from the ME/CFS community also experienced. My hands and feet were numb. I remember trying to reach out the door when we got to the emergency room, and I just couldn't get my hands to close around to open the door. And so my husband had to drag me into the emergency room. I was sobbing the entire time because I had no idea what was wrong. No one was really talking about what long hauling was. And I later learned that that night they drug tested me. And I found out much later that that very same hospital drug tested me 3 times. They also told me it was still anxiety when I came into that hospital that night with intermittent paralysis and a heart rate of 160 and high blood pressure, that it was just anxiety. And at that time, I discovered the long haul community. And so I started making friends with people who were long haulers, and we would have discussions about like hospital care treatments and these things and experiences in the ER. And that was when I met my friend Miranda, who I call my COVID twin. She has very similar, very, very, very similar symptoms that I have, which is a reaction to basically all food. We kind of have a allergic reaction to it, which is part of MCAS, which is part of the bill and why that's important. And that's when I realized that she had never been drug tested. And I realized that she was getting so much treatment that I didn't know was even available to us. And it was like hurt on top of hurt, because here I was just trying to do something basic, like survive for my child. Like all I wanted to do was to live through this so I can continue, so my son didn't lose a mom. And then that's when I realized that I was facing discrimination. And there was one time when I was admitted into that hospital where I saw that I think I was administered Narcan. And they never have an explanation of why that happened to me. And of course, all my drug tests that they drug tested me came back negative, because I don't even smoke, or I'm just a nerdy person. I don't do any of those things. And so I've never even gotten answers as to why I was drug tested with those symptoms of tachycardia. And I've since been diagnosed with POTS. And so I realized that I was having a different experience than my white long haul friends, with very similar, if not same exact reasons for going into the emergency room. And I was getting a different set of care. Like, I didn't know that I was even supposed to be able to get physical therapy while I was in the hospital, because by the time I was admitted in the hospital, I was in a wheelchair that deteriorated so bad with COVID, and I was in a wheelchair for about 3 months this past year. And so the reason why this legislation is so important to me, because we're finally addressing disparity. Like, it's good that we had the original funding, but if we don't talk about the disparities and address the disparities, and even teach doctors in the ER and the specialists that I see that see other Black women, what COVID looks like, and not to say it's all this anxiety, and to empathize, then we're going to have more senseless deaths in the marginalized communities that don't have to happen. And I'm thankful for Advocacy Week, because a lot of you guys would never hear this story or hear a lot of our other stories or even know why it's so important. But the knowledge of what disparity looks like is going to save countless Black women's lives when it comes to the education part of the COVID-19 legislation. And I'm just thankful that this is finally happening. And I'm really, all I ever wanted when I was alone in the hospital on those nights, I spent about 30 days in and out of the hospital, post-COVID, not from acute COVID, from post-COVID. And I said to myself, we can't let this happen to more Black women, because if I, with great insurance, my husband is a federal worker, can be at the point where I almost lost my life to medical neglect and discrimination, then how many more women have not? And I'm glad we're on our way to counting and solving this problem. Okay.
Cynthia, thank you so much for sharing that story. That is so powerful. And I know I've heard it before, and it still makes my heart ache. And I just wanted to, again, thank you for the bravery of sharing that, and especially thank you for the bravery of going to your member of Congress and sharing that, because Representative Beyer, your member of Congress, as you know, has taken action and leadership to really hear hear your issues, recognize that you're not the only one. There are many, many women, especially women of color around the country, who are having these experiences that we hear from every day. And we really are excited, as Representative Beyer mentioned, the AHRQ, the Agency for Healthcare Research and Quality component of the bill, specifically drills into and makes recommendations to avoid, identify, and mitigate racial, geographic, and ethnic disparities as part of this legislation, as part of this research. So thank you so much. With that, we are ready to open up for questions. And I just want to remind everyone that questions about the bill and specifics about the bill text, there will be a press release on Representative Beyer's website, which is Beyer, BEYER.house.gov. That'll be up in the next few hours after we wrap up this press conference. So I just wanted to share that information with everyone. And without further ado, we'll go ahead and open it up for questions. I know we have a couple that have already popped up in the chat box that I'd like to pose to our panel here today. And I'm also available to help answer any questions myself as well. So first question comes from Sherry. Why did you decide to announce the COVID-19 Longhaulers Act today? Any special reasons or sponsorship, or was there sponsorship reach needed at this point? That is an excellent question. And I'll go ahead and answer that for you, Sherry. There's a couple of reasons, quite a few, but as you know, or as you may know, we had over 1,000 advocates register for yesterday's Advocacy Day here on Capitol Hill. Cynthia was one of our participants, where we mobilized people with long COVID, people with ME/CFS, and others in the complex chronic illness post-viral community to speak to their members of Congress. We took over 380 meetings yesterday virtually as we digitally went to Congress with these issues. And of those meetings, 55 were member level meetings, and all of our advocates were speaking on exactly these points, specifically to raise awareness and invite additional support from members of Congress for the COVID-19 Longhaulers Act, and also to raise awareness about the overlap of long COVID and ME/CFS, and to ask for additional support for post-viral research in its existing forms, both at NIH and CDC, to continue to explore and, if you will, peel the onion of how all of these different post-viral illnesses are related, and how those existing post-viral illnesses are playing out in a COVID-19 aftermath. And again, I just would want to reiterate that statistic that Oved shared, because I do think that is so important to understand that that statistic that was shared by Dr. Anthony Komaroff of Harvard University, that it is estimated that there will be $4 trillion with a T, $4 trillion of economic cost in the next 10 years, just from the chronic illness that follows COVID-19. That doesn't even include the acute pandemic response, the massive cost of death and shutdowns. Everything else that happened at the active phase of the pandemic is not part of that figure. That figure is just the chronic illness that will follow COVID-19. So thank you so much for that question, Sherry. I think that was a really important one to share. So now I'll open it up for additional questions. Were there any other members of the media who would like to open up their microphone and ask a question of our panel? Okay, I'm not seeing any popping up across my screen, so we can open it up for other members of the ME/CFS community who would also like to either share your thoughts. I'm seeing so many in the comments of your thank yous and good wishes. We will definitely share those with the members of Congress. So many constituents turned out today. We're so pleased to see that. Thank you all so much for sharing your voice and your stories and your gratitude, because we share with you in that gratitude that Representatives Bergman and Representative Beyer have really come through to be the leaders on this very important issue. Wonderful. So are there any other questions that are popping up from members of the media? I want to make sure we get your questions answered first. Oh, okay. Drew, any on your end? Just making sure I don't want to cut anybody off. Wonderful. All right. I think we're good. Thank you so much, members of the media, for your questions. And again, if you have any other follow-up information or have a request for interviews from either the Long COVID Alliance, the Solve M.E, or from the members of Congress and their offices, Drew, if you could put that last slide on with Carmen's address, just for those folks who might be jumping off. So again, if you would like to request an interview, would like to follow up with additional questions, or have another question that's not answered in the bill press release that will be coming on in the next few hours. Again, the bill press release will be at the Beyer team's website, which is Beyer, Beyer, .house.gov. Please check that website in the press section for the next few hours to get a full press release about the bill. If you have another request for interview, or you have a question that might need a deeper answer than we can answer in this panel today, please feel free to email our Communications and Media Relations Manager, Carmen Creglow. You see her email address there, Creglow, Kregloe @solvecfs.org. We're more than happy to have requests for interviews or additional questions, maybe with follow-up. So we'll go ahead and start taking questions from the rest of the community in the chat. And Cynthia, I don't know if you can see all the praise that is coming through on the chat for you, but there is much love and much gratitude for you coming forward and sharing your story. So thank you so much. And of course, your advocacy made all of this possible. We wouldn't have ever had the conversation with Representative Beyer had you not been able to open those doors as a constituent. So we are so grateful for your hard work. And I know that's especially meaningful when your energy and health is so limited. So lots of love and gratitude for you in that work. I'll go ahead and start taking questions here. We have our first question from Phil. Phil, would you like to ask your question live? We can unmute your mic. Phil Akinsai. My apologies if I'm mispronouncing your name. Phil, please go ahead. We're welcome. The floor is yours.
So there's a lot of groups and a lot trying to be accomplished. And I'm not sure how much new money is pointedly for actual clinical studies of potential therapies and laboratory studies of pathogenesis of these illnesses.
That's an excellent question. As you know, there's some segmentation in the roles of different agencies in our government. And that kind of research, that clinical trial research or pathogenesis research, is generally the heavy science or basic science. And that is the role of the National Institutes of Health. So NIH is responsible for those kind of studies. And as both congressmen mentioned, recently at the end of 2020, so this was in December of 2020, the economic COVID-19 relief package that was passed at the very end of that year included $1.25 billion for NIH specifically to look at the long-term effects of COVID. And so that would be one of their responsibilities, and something we have been strongly advocating to NIH for, to look at clinical studies, treatments, trials into that deep dive pathogenesis kind of research around long COVID and these related post-viral illnesses that we already know so much about, but yet know so little at the same time. So in this specific bill, we do not focus on NIH. As I already mentioned, they've received $1 billion over 3 years that's expected to address those kind of research questions. What this legislation, the COVID-19 Longhaulers Act, looks at is the other elements that NIH doesn't do, specifically medical education, which is very important, but that's the role of CDC. Also, the research that Cynthia described about disparities and access to care, which is something that is happening right now every day, and especially Black and Brown families, especially Black and Brown women, have been unable to access the same medical care as their white peers with the same illness. So that's what that AHRQ, the Agency for Healthcare Research and Quality, that's what that component of the bill specifically zeroes in on. And then the last component, which with Representative Beyer described, is the data harmonization. And so this is not looking at those deep dive studies that you described, but looking at the results of those studies. And how are we sharing those results with other researchers? How are we sharing those results with doctors? How are we making sure that what one group finds specifically in ME/CFS is being cross-compared to other groups with POTS or other groups with mast cell or other studies looking at just long COVID in isolation? all of this data can be combined into a giant data set, and we can leverage that information to accelerate research more quickly. And that data harmonization infrastructure, or that data alignment infrastructure, is the PCORI elements of the bill, the Patient-Centered Outcomes Research Institute, which again, which Representative Beyer mentioned, and that 30 million that he described is specifically for PCORI to harmonize all of the results of that science. And the other thing I'll add, and why I think, in my opinion, PCORI is the right agency for the job, even though they're not an agency, is because PCORI was specifically designed to be a bridge between the patient communities and the research communities. It's a connector in private sector and public sector. So while NIH is doing all of this research, they're not doing it alone. There's a lot of amazing nonprofits, a lot of amazing academic centers and labs, a lot of privately funded companies that are also doing this research. So PCORI and the investment in data harmonization truly, I believe, will be the way to get answers fastest, because instead of just waiting for the NIH to fund their studies, we're bringing all the data from all the studies across multiple fields, across multiple funding streams, bringing them all together to be a centralized data set that will get us answers faster. And actually, Oved, maybe I can share that, pass it over to you to discuss a little bit more about why data harmonization and patient registries are really the way of the future.
Yes, thank you, Emily. And I think there was also a question about how would people be included in those studies if they did not have a positive COVID test. So maybe I'll start just with that question, which I think is really, really important. As Cynthia said, back in March of last year, tests were extremely limited. There were specific indications, and frankly, most people who had a mild or moderate disease just didn't qualify. So as we now go back and try to understand what triggered their disease, I don't think we can really rely on a positive PCR test, and frankly, many of the tests that were used at the time, even by the FDA standards, were not of high enough quality. So I think we just need to accept the reality that we're going to have to understand what led to people's disease without a positive a PCR test. That was just not going to be an important criteria if we all want to understand the full spectrum of this disease. I think this is a discussion that has been now going on with some of the agencies, and I think that most researchers understand that although it would have been ideal to have a definitive test, that is just not the case. And so that's something that we need to take into account. More broadly, I think that being able to understand the experience of as many people as we can right now through registries, through other studies that really go beyond the typical clinical studies that involve smaller number of people who go to a clinical setting, a clinic or a medical center. In the reality that we're in today, it would be a lot easier for people to participate and provide their experience through other means. So, for instance, registries like the one that we launched last year, which are web-based and really allow people to record their symptoms through an app on their smartphone. These are going to be the ways that people can participate in research more broadly. And frankly, this is the promise of big data. The more information we can gather, even if it's imperfect, but having more information from more people with a very diverse ethnic and genetic makeup would help all of us really understand what's really underlying this disease and why do some people recover, why do some people recover in a different way. All those things are going to be learned from a large participation.
Thank you so much, Oved. And I just want to add to that point regarding the folks who were unable to get testing at the height of the pandemic, so they never received a positive either PCR or antibody test. As we know, again, this is published data from the CDC itself, that communities of color and low-income communities were disproportionately hit by COVID. And unfortunately, these are the same communities that had additional barriers to get testing. In fact, the CDC itself told people with mild cases at those early stages in March and February of the pandemic, if you're feeling symptoms, but you're not severe, stay home. Don't get a test, reserve the tests for the people who really need them, which means there are thousands and thousands of families just like Cynthia who got COVID but did what they were told, followed the public guidance, did not get a test, and now they have additional hurdles with their long COVID to getting answers and treatment and even inclusion in clinical trials. And this is something I really have to highlight because another amazing advocate named Shamir El Smith has been pioneering the voice of the long haulers who have been excluded from clinical research because they did not have a positive COVID test at the time of their initial infection. And that's by no means their fault. And again, specifically disenfranchising members of the Black and Brown and low-income communities and underserved communities that were, again, doing as they were told, following CDC instructions, not getting tested. And yet here they are a year later, they're too sick and they're not allowed to participate in clinical trials. So again, I'm really excited about the component of the COVID-19 Longhaulers Act that focuses on data harmonization, because that'll help understand and clarify where the differences are in these different groups, if there are any. It might just be a question of access. So I'm going to go ahead and wrap up because we're almost at time. So I will take just a handful more questions that have been shared here. And some of these are really fascinating and really important. So really quickly, Anne, you asked some two back-to-back questions that specifically about ICD-10 codes and about CPT codes for long haulers. Again, that's not something that's controlled by Congress. That is a CDC level issue. So the members of Congress could maybe write a letter or something to that regards, but it's not an issue that we're tackling in this specific legislation here. That would be a different avenue of approach with CDC. But I will say on behalf of the Long COVID Alliance, this is an area of much interest. We've been following it very closely. We're working with some amazing partners and we've submitted some proposals to CDC in these areas. But again, that's not related to the legislation specifically here today. And then the last question that I'll take before we have to sign off is I see our advocates on the call. Love you all. Thank you for sharing your thoughts. So what can we do as advocates to support this effort going forward? And what is the plan in terms of getting this bill passed? So that's an excellent question, and I'll be happy to share a little bit about that. And before I do, though, Cynthia or Oved, did you have any final remarks that you wanted to share before we answered these last questions?
Yeah, I do have something I wanted to add. One of the things that I didn't say during my story was one of the times when I went to the hospital, I was threatened with security because I went to the hospital to seek medical care. And it was during the first time, it was during the first time that I actually was experiencing things like my oxygen fluctuating. It was very scary. In fact, I was terrified that if I went to sleep, I would die. So when I went to the hospital, I said, hey, I'm noticing my oxygen is dropping in my sleep, and when I'm awake, can you guys monitor me while I'm sleeping? And they originally agreed, and then afterwards, another nurse came in and said, you have to leave, and she threatened me with security and had them escort me out as I was asking for care. And during that time, I was in a wheelchair, by the way. So I'm actually glad this is coming up now because we're having this national discussion about policing in Black bodies. And one of the things that I think is being missed from the discussion is something that a lot of Black women say is that policing to Black men is the medical community to Black women. And that's absolutely true. And I also feel like some people are being discouraged for coming to the hospital for care because we know we will also be policed there as well. And that's another reason why I'm so glad that this legislation is coming out at the same time that we're addressing the police brutality and the policing issues that we're having elsewhere in this country, because it actually does go hand in hand in what is happening as a nation. And I'm thankful that hopefully we can get that legislation addressed in Congress, as well as this legislation because it actually ties in together. The issues do tie in. Or when it comes to Black lives, it's not just Black lives in policing on the streets living your day-to-day life. It's Black lives being policed when we're asking for medical care and medical treatment.
Thank you, Cynthia. That's such a vital and important comment, and thank you for sharing. I think that many folks, and I'm just sharing the thoughts that are being shared in the chat right now, agree with you and are and think that that is a key element we need to prioritize. And I'm really excited for the elements of the COVID-19 Longhaulers Act that do start to investigate these critical issues of disparities in the healthcare system, especially as it applies to folks with long COVID. Oved, is there any final thoughts that you'd like to share with our group today?
Thank you very much, Cynthia and Emily, and of course for the Congress, for the congressman. And I just really wanted to thank the media members who are paying attention to something that has been ignored for such a long time. And frankly, maybe that's the only comment that I wanted to say, which is that, you know, if we were all doing our job for the past 30 years or so and paying attention to people who are suffering, we probably would have had all the answers that we needed to alleviate more pain and suffering from long COVID, people with long COVID. So hopefully we're all going to take up this opportunity to study what we need to study and find treatments and solutions. So for all the advocates who are part of this effort, we're all grateful for you for being part of that.
Wonderful. Thank you so much. And so for our final comments today, I'll just add that for our members of the media, again, please take a look at Representative Beyer's website. His press release will, regarding the details of legislation will be up in a few hours. And that again is Beyer, BEYER.house.gov is, and you can go to the press section of his website there for the full press release about the bill. I'll also add for our advocates and our community members on the call, thank you so much for taking the time to join us with a special announcement. If you want to take action, the action kit for Advocacy Week is still live. And as you know, this was a major part of our efforts for Advocacy Week this year was the COVID-19 Longhaulers Act. If you go to Action Kit 21, that's action, like taking action, kit, like kick the car from Knight Rider, and 21 because it's 2021. So actionkit21.com. No www necessary. Just type actionkit21.com into your browser, and it'll bring you straight to our action kit. There's all of your instructions for calling Congress, for emailing Congress, for posting on social media to get the buzz and excitement about this legislation out there. For members of the congressional staff who are on the call, if you would like more information or are interested in becoming a co-sponsor or would like to see draft language, you can email Kate Schleisler in the office of Representative Beyer directly for any members of Congress or their staff who would like to continue working on this bill with Representatives Beyer and Bergman. So thank you all so much for your time today. This has truly been an absolute pleasure to share this work of many months with you. A special thank you to Cynthia and Oved for sharing your insights about the two specific parts of the bill related to data harmonization and disparities research, both critical needs for our long COVID work right now. And again, a special thank you, and with lots of love and respect, to Representatives Beyer and Representative Bergman, who have been our champions on this issue, who have taken action. And with your leadership, we're going to improve the lives of a lot of Americans still struggling with COVID-19 symptoms. So with that, I'll bid you all farewell. Thank you once again for your time. Last but not least, if you could put that last slide up on the chat one more time. Perfect. Thank you, guys. If you have requests for interviews or have specific questions from either media or advocates, you can go to either solveme.org, the Long COVID Alliance.org, or if you'd like to request an interview with either any members of our team, or we can facilitate an interview request with the members of Congress as well, please go ahead and email our Communications and Media Relations Manager, Carmen Creglow, at kcreglow, that's KKREGLOE, at solvecfs.org. Thank you all again so much. Thank you for helping us #Stop the Long Haul. And once again, our #Trust Patients, because as you heard from Cynthia, there are so many out there, and this is all about them and getting them back to wellness. So thank you all once again for your time. Enjoy the rest of your day.